This article, Characteristics and Outcomes for 61 Cats that Underwent Either Surgery or Stereotactic Radiotherapy as Treatment for Intracranial Meningioma, 2005 to 2017, by Michelle Tishner, Kendra Heron, and Laura E. Selmick, published in the Journal of the American Veterinary Medical Association. Explores the clinical features and outcomes of cats with intracranial meningiomas treated with either surgery or stereotactic radiotherapy (SRT). Meningiomas are the most common primary brain tumors in cats, representing 56% to 58% of all intracranial tumors. They are generally considered benign, slow-growing, and solitary. Due to their characteristics, the primary treatment recommendation for intracranial meningiomas in cats is surgical removal. However, surgery carries inherent risks and complications, and factors such as tumor location, size, and patient health may sometimes make surgery unsuitable. Radiation therapy has emerged as a crucial treatment for intracranial neoplasia in both humans and animals, serving as both a primary and supplementary treatment. SRT delivers a focused, curative radiation dose from multiple angles, effectively targeting the tumor while minimizing damage to surrounding healthy tissues. SRT generally involves fewer treatment sessions compared to conventional radiation therapy, typically requiring 1 to 3 fractions. The CyberKnife system is one type of SRT system that utilizes a robotic arm-mounted linear accelerator, allowing for precise radiation delivery and minimizing exposure to normal tissue. This retrospective study aimed to examine the clinical characteristics, treatment outcomes, and survival times of cats with intracranial meningiomas treated with either SRT or surgical excision. The study included 61 client-owned cats diagnosed with intracranial meningiomas based on histopathology or strong evidence from advanced imaging, MRI or CT. The study excluded patients with more than 2 possible diagnoses other than meningioma. Researchers gathered data from medical records, including signalment, clinical signs, duration of clinical signs, diagnostic imaging reports, histopathology reports, treatment protocol, complications, recurrence or progression, and survival time. They also conducted follow-up phone calls to collect additional information. All available imaging studies were reviewed by board-certified radiologists or neurologists, and tumor location was categorized into 3 groups: forebrain, cerebellum, or brain stem. Histopathologic diagnosis was determined from available reports or medical records, with presumptive diagnosis made based on characteristic CT or MRI features. Of the 61 cats, 46 underwent surgery as the initial treatment, 14 received SRT initially, and 1 cat received surgery followed by SRT due to incomplete surgical removal. Figure 1, a Kaplan-Meier curve, illustrates survival and recurrence probabilities in the 61 cats based on treatment type. The curve shows a clear difference in survival probability between the surgery and SRT groups. Table 1 presents the characteristics of the study population, categorized by treatment type, surgery or SRT. It details the distribution of tumor locations, the occurrence of peritreatment complications, recurrence or progression rates, survival outcomes, and survival times. Out of the 46 cats who underwent surgery, 74% experienced complications during or after surgery. Anemia was the most frequent complication, 54%, followed by inappetence, hypokalemia, cranial nerve deficits, hyperthermia, ataxia, hyperglycemia, and seizures. 2 cats needed a second surgery due to cerebral cerebellar herniation and hemorrhage but recovered well. 1 cat experienced seizures immediately after surgery and died. In the SRT group, only 1 cat experienced immediate complications, hyperthermia and tachypnea, which resolved quickly. At the time of data collection, 54% of cats in the surgery group and 64% in the SRT group had died or been euthanized. The median survival time, MST, for the surgery group was 1,345 days, significantly longer than the MST of 339 days for the SRT group. In the surgery group, causes of death included recurrence or persistent neurological signs, 44%, unspecified reasons, 44%, and other causes such as old age, weight loss, and poor appetite, 12%. In the SRT group, deaths were attributed to neurological signs, 44%, unspecified reasons, 44%, and other factors like hiding and anorexia, 12%. Tumor regrowth or the development of new tumors was confirmed in 30%. Cats in the surgery group and 28%. Cats in the SRT group. The median time to progression was significantly longer in the surgery group, 1,183 days, compared to the SRT group, 315 days. Table 2 summarizes the characteristics of the 4 cats who experienced recurrence after initial SRT treatment, while Table 3 details the 14 cases with documented recurrence following surgery. These tables provide information on age, sex, breed, tumor location, clinical signs, specific meningioma subtypes, number of recurrences, time to recurrence, treatment for recurrence, and the final outcome for each case. Previous studies reported a median survival time, MST, for surgically treated intracranial meningiomas in cats ranging from 693 to 1,125 days, with a 2-year survival rate of 50%. The MST of 1,345 days observed in the surgery group of this study is notably longer than previously documented. However, the MST of 339 days for the SRT group falls short of the reported MST for surgical treatment. Tumor location might have played a role in the lower MST observed in the SRT group, as the only 3 lesions located in the brainstem were in this group. Previous research suggests that meningiomas in less accessible locations, like those in the brainstem, are associated with shorter survival times. This study highlights the safety and effectiveness of SRT as an alternative treatment for cats with intracranial meningiomas, who may not be suitable candidates for surgery due to factors like tumor inoperability, health concerns, or owner preference. While the surgery group demonstrated a significantly longer MST 1,345 days or 44 months, the SRT group still achieved an average survival time of nearly a year, 339 days or 11 months. Due to the limited number of cases that received SRT for subsequent recurrence, the study could not conclusively determine the impact of SRT on prolonging survival time in these situations. Future studies with larger sample sizes are needed to better understand the role of SRT in treating feline intracranial meningiomas, both as a primary treatment and as an adjuvant therapy for recurrence. The study acknowledges several limitations, including the lack of a definitive histologic diagnosis for all SRT-treated cats, the small sample size, particularly for the SRT group, and the absence of consistent follow-up imaging for all patients. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.